I'm still amazed. Like,
You're still amazed.
I'm still amazed.
Okay.
That was crazy.
See, it just, in 3 years, you were.
Yeah.
See, this is like common.
Yeah,
If I see 10 people, 8 of them are like you.
right.
It's just weird.
I'm excited to see what else.
Okay, so what we'll do is we'll just go through your whole body.
Okay.
You may not have any more sore spots, but we'll find out. Go ahead and start on your back, I guess. Wherever you want to put your head is easier. You lay on your back looking up and...
All right.
Okay, so you comfortable?
Yes.
Okay, so I'm gonna start here between your breasts, okay? If you
Okay.
get a bad spot, you tell me.
Okay.
Or even a tickle spot. Or if I press here and it makes you go numb somewhere. that's
You're
okay.
pressing there and it's going to my mid back.
Okay, so you feel that weirdness in your back. Tissue here. It just works. Okay, so yeah, give me this hand here. And when I squeeze in here and press in here, don't let me hurt you. Okay?
Okay.
So you feel that in your back?
My
right now?
mid back. Yeah.
Okay. Do you feel it now?
No.
See? So we'll hold that.
What the heck?
This is advanced. People call me a scammer, but it's real, isn't it? It's not bullshit.
No, that's
Oh, even if it
crazy.
is, who cares? It's gone, right?
Yeah, exactly.
Placebo effect. All right, so, and all this is going to make a big difference in how you feel.
Wow.
Okay, so, what? Okay, now, let's check the neck here real quick. Right here? Okay, well, feel that right there.
Mm-hmm.
You can still feel it.
Mm-hmm.
It still hurts there?
It's less.
It's less, okay. Let's come over here. What about now?
No.
Okay, we'll hold that. Once it disappears, I hold it for about 20 seconds.
That's amazing.
It is amazing.
Yeah, right in the towards the back. Right there.
Right there?
Mm-hmm.
Okay, well, let's try the same.
And when you hit right there, it's
Yeah.
going to my mid back again.
Okay, all right. What about now?
No.
Okay, it's gone, not going your mid back.
No, it's gone.
Okay, we'll hold that for 20 seconds. See, these sore spots have body-wide implications.
That is crazy.
And people just ignore them. They have not a clue. And a lot of people suffer needlessly.
Wow. Yeah, I have tightness. Yeah, right. Mm-hmm.
Which side?
Ball.
That's tender in there?
Mm-hmm. On both sides.
Figure out where it is.
I think it's because I grind.
Yeah, probably. You feel that right there then.
Mhm.
What about now?
No.
Isn't that cool?
What the heck?
Magic.
Wow.
One massage therapy educator told me that I was dangerous to the minds of young massage therapists.
That's insane. This is amazing.
It is amazing. Okay. Now,
Wow.
say this one over here.
Mm-hmm. No. Right there.
Right there?
Mm-hmm.
And what about now?
No. And that's just pressure points?
Yeah, it has to do with muscle chains. This muscle chain runs right up into the jaw from the hands here.
Just something softer.
Wow.
Okay, it's probably more. We're gonna check your abdominal area. Okay, where's your belly button?
I don't have one anymore.
You don't have one?
No.
Well, where would it be? Okay, right here.
Yeah.
So you tell me
the heck?
These tender spots in the stomach, they cause a lot of discomfort.
Yeah, what organ is right here?
It's a ileocecal valve, maybe. I mean, that's people who get headaches a lot, stuff like that, always have a sore spot right here.
You're like right under my, yeah, right there.
Right there too.
Mm-hmm.
Well, let's try to bring now let's go down to here. You feel that, right?
Mm-hmm.
What about now?
No. That is insane.
We'll check your wrist. Probably. Other side. Turn it over. Okay. Now let's check your side.
On my right, on this side.
This side?
Yeah.
You feel that right there, right?
Uh-huh.
What about now?
No.
See, this side of the body is neurologically connected in the same spinal segment, so I can take it out right here.
That is crazy.
Alright. Okay, now let's have you turn over. The only problem is your neck's going to have to be the side, won't it? You don't have to face it. Well, that's okay. You just, if your neck is on this side,
This
you're
one
gonna,
has. Right. Totally turn.
okay, hopefully you'll be comfortable. Let's okay, so now let's check. Oh, this is your, which side was your bad?
This side.
Okay, all right. So I'm gonna just, you tell me if I get to that.
I mean, right, it's my whole neck, it's
Okay.
my whole side neck. All the way up to the base.
Okay, so that's tender when I press.
Yeah.
Here, you feel that tenderness now, right?
Mm-hmm.
What about now?
No. Mm-mm.
Right here.
Yes.
That's sore?
Yes.
This will work, but I'm gonna come over here and just see if this, feel that now.
Yes.
And then what about now?
Too hard. No.
Okay. See, this has to be a firm pressure, but don't let it hurt, because this initiates the reflux that it gets relaxed.
Mm-hmm.
What about now?
No. Oh, right there.
Right there, huh? I'm not sure if this will work, but we'll try it. Well, yeah. What about now?
It's the last where I still feel it.
What about now?
No.
Okay, I'll hold that. about now?
It's less, but it's still there.
What about now?
It's still there a little.
Okay, so we'll come over. What about now?
Now it's not.
Okay.
Yeah,
Right here.
that's very tough.
Okay. What about now?
It's lighter, but I still feel it.
What about now?
Now it's gone. Like someone would have to lay down and experience this to
Realize it, right?
realize.
Yeah, I show it on, YouTube, and they think it's fake. They
It's
think
not.
you're an actress. or
Yeah,
something.
no, it's not. Believe me, I'm gonna tell you. Yeah, right there.
Okay. Let's just show how weird this is. Like, you feel that right there, definitely, right?
Mm-hmm.
What about now?
No, it's gone.
Everything's connected. That's why you have to go through the entire body until your complaint is the neck. And this is, I'm gonna treat you like 3 more times.
I was gonna say, how often?
Well, to do it, well, we'll talk about that later. Let's get
Okay.
this.
Oh, yeah,
Right here,
that's
huh?
always, yeah.
All right. Well, let's just see if this works. You feel that right there. What about now?
Wow.
Gone?
How the heck?
I hope your audio picks up on this video. Right here? What about now?
It's light, but
What about now?
still same light.
Okay, then we'll come over here. What about now?
No, now it's gone.
Good.
It's weird because I'm feeling something on my right,
Yep.
like shoulder.
Oh, so you still feel some weirdness?
But
On
it's
the
not
right.
where you're touching.
Okay, all right. Well, we need to,
That's
we need to
weird.
clear that out. Okay, so what about now?
It's less.
Okay, I'm gonna come over. What about now?
Now it's gone.
Everything's done, right?
Yeah.
Okay. Yeah. So if there's some weirdness anywhere, and even tickles, numbness. Okay. What about now?
No, now I just feel your hand.
Okay.
I just feel scared.
Okay. Well, like I said, we can miss some places on this session.
Right there.
Right here, huh?
Gosh, yeah.
You feel that? What about now?
I still feel it.
Okay. What about now?
It's less.
Well, what about now?
I still feel it.
That's
That's a good one, yeah.
about. Okay, well, let's, what about now?
It's definitely less when you hit there.
What about now?
Now it's gone.
Okay. Right here?
I just feel like you can touch it.
Okay. I'm not hurting your
No,
ankle.
not-
Okay. That's kind of not good, huh? What about now?
Left,
What about now?
same.
Okay. What about now?
Now it's gone.
We'll have to put a young guy's head on this video. Trying to look cool, you know, and you just 71, you just can't do it. Alright.
Right on the right side, right there.
Right here, huh?
Uh-huh.
Okay. What about now?
Now it's gone now.
Magic.
That's insane. And you're not even massaging or doing anything.
No, you don't have to. Okay, so I'm gonna hold some points here.
It just like relaxed my back.
Oh yeah, I don't even have to touch your pain to make it go away. Okay, now we'll have you slowly sit up, and I'll do that same technique. I'll do a similar technique to what we did yesterday.
I literally feel like I just got a massage.
Yeah. Okay. So the bad
Oh
side.
my gosh.
Okay. So
Wow.
put your hands here, and don't let me hurt you. I'm gonna come in here. Okay. Now turn your neck. Should feel pretty good.
That's crazy.
Better, isn't
I couldn't turn that far yet.
I know.
Before
it?
yesterday.
Yeah.
Somebody else has to feel this to believe it.
Yeah, nobody absolutely, you know, I demonstrated this in front of a whole bunch of medical doctors. They were all standing around, like about 8 of them.
Like you would have to
What the hell? They didn't-
experience this to believe
They
it.
did, you know, and I was working on their patients. The patients had this shit's real, so they ended up hiring me.
Yeah, this is amazing.
Yeah, okay, so there you go. That's the treatment. I want to do this like maybe 3 more times.
Oh,
And I'm
definitely
not going
want
to charge
do
you
it.
because I like the video.
Yeah. Oh yeah, this is amazing.
Yeah, it's cool. You want all that other stuff you went through. What did they tell you was wrong with your neck?
I went through
Did they-
physical therapy for almost 3 years.
Yeah, I know. All the time.
The chiropractor told me it was because one collarbone was higher than the other,
Oh.
and he went in and cracked my chest. Man, that burns. And I still didn't get as much movement as I do now.
Yeah, well, you're gonna be
Like
fine.
you guys, one of you has to try this.
Any of you guys?
Is your
sore?
neck anything hurt?
You guys are so young. I can't believe it.
I have a weird thing with my shoulder, but I don't think it's fixable.
Oh, really?
Oh,
No,
but
seriously.
what
what's
you
wrong
have to
with
you
it?
have to try it.
Well,
to
you can
believe,
feel
like-
it. It's really weird. It just pops every time.
Oh, it pops.
Oh.
So does it hurt?
Oh, that's
Yeah, it hurts.
crazy.
But
It hurts when you move it. Where? Right?
You can feel it when it pops.
Oh, right here. Well, let's see if we can fix it.
You gotta try it.
Yeah.